there's a question or few questions in the chat that I have to read. One came from Oloribe, Professor Oloribe. I will read the question, and I don't know if you already addressed the question throughout this podcast, but what he asked is abortion legal in Malawi? I think that was already cleared. Do people have access to family planning resources? Is sexual education taught in schools and colleges? And what is the prevalence of illegal abortion and its consequences? I think Professor Obina, I think the information he provided, he may have answered all these questions, but I will leave it up to Henderson to address this question. Again, the questions are, is the abortion legal in Malawi? Do people have access to family planning resources? Is sexual education taught in schools and colleges? And what is the prevalence of illegal abortion and its consequences? Yeah,
You can
Henderson,
hear me?
can you turn on your video? By the way, anybody now, you can turn on your video if you want, since we are on the question section now. So did you hear the questions I posed? I think it came from Professor. Go ahead.
You can repeat it.
Okay, so is abortion legal in Malawi?
Okay, the abortion is illegal. It is only allowed in some other circumstances where a woman has some complications, but not all women are allowed to do the safe abortion.
Okay, so we know that, and I think we also know the answer about do people have access to family planning? I think you covered that. And the one I think you have not covered, I think you even covered the prevalence of illegal abortion, I think, but you didn't say the number. But we know that you mentioned that there's a lot of illegal abortion. But is sexual education taught in schools and colleges?
Yeah, of course, the government has introduced a new curriculum, and sexual education is also part of the curriculum, which we have also started to learn in primary schools and also secondary schools, including at tertiary level.
Okay. Okay, Obina, I hope your questions are answered. So I'm going to go, there's hands up here. Let me go first to Teresa, and then after that, I'll go to Zach. Teresa, go ahead with your question. And if you can, if you have a video, you can turn your video on if that's okay.
I'm sorry, Dr. Melo. I'm in a event. I just took liberty to be away from the event to attend this podcast.
No worries.
Yeah. Thank you, Anderson. I think you brought a lot of good information to our understanding. And you made it very explicit. I only have one question for you. The psychosocial implications, the economic and the disparities, the illegality of abortions in Malawi. However, from every single situation that I've been made aware, what we consider the urban lifestyle syndrome affects everywhere, even in United States, meaning that the so-called urban area, the township girl, we call them in Nigeria, they travel home, including the men, to infect the young girls in the rural area or villages. How do you mitigate that? Am I on?
Yes, we heard you.
Okay, how do you mitigate this? Because this is a major concern that some of us in our own little way, little program, we've tried to put a cap, but we can't do anything about it because the men who lives in the big cities travel home on a weekend, just no hold back, meaning they can do whatever they want to do. And the young women or women in general, let me put it that way, who lives in the city also come back to the villages. I don't want to say rural area, to the villages where these young men and women seem to be stagnant because of lack of economic opportunity. How do you mitigate this urban health syndrome in Malawi? That's
Yeah,
number
I
one.
think
And I'm sorry, so that I don't take much of your time. Then subcategory of that questions is that are women sitting at the decision table in the parliament to frame decision-making concerning reproductive health in Malawi? Thank you so much.
Thank you very much. First, let me respond to your first question about young men or people from town going into village and how can we mitigate it. I think it's something which I've been saying to say that we need to intensify the knowledge on how young girls in the community or in the villages can able to also protect themselves, because most of the young girls in the village, they are much vulnerable, especially here in Malawi, because they don't have knowledge and they think those who are coming from town, they are the ones who can able to at least save them from their poverty. So it's an issue where before they come to the village, this village girl, they should already know something on how they can able to protect themselves, like some life skills. On the other question about women in parliament, of course, it has been an issue. That's why if you see from 2020, there have been some advocacy trying to make sure we have women representation in parliament or in decision making, not only in parliament, but in decision making position. I think up to now, including UN and other international organizations, they are still pumping in a lot of resources to make sure women, they have at least a good representation on most of the decision-making positions. That's why you can see there's so many call for proposals about women to at least take part on decision-making. So here in Malawi, even this, the election which has just ended last month, we have at least noticed that a percent has gone high for women representation in parliament. So we are striving on that one. Thank you very much.
So this is a good question.
Dr. Melu, I'm sorry. I need a clarification on one thing. Because
hold on.
Okay.
Before the clarification, I wanted to speak on this.
Okay.
I want to make it clear to everyone that everyone in Africa comes from a village. So I want to make this clear, the construct of a village. There's no person in Africa that doesn't come from a village. That's a fact. So in Africa, it's structured into tribal groups. So when somebody moves out of a village due to maybe job or education and stuff, they go in there. Yes, there might be, and by the way, before I even jump into this, any township in Africa used to be a village. So as it develops, different lifestyle emerges within that. So at the end of the day, obviously the day will also end, is that the fact is, the question also, more important question we should be asking is the family integrity. That's what we should be asking in general about Africa. I think most of us in Africa are lost. We are definitely lost. There's a lot of family disintegration happening. And I think a child will be safe if there's a strong cultural family values that is already instilled in a child. No matter what situation they encounter, they will be able to navigate that. The fact that there's what Teresa asked, and there's a lot of women falling vulnerable to this type of behavior. People that used to come from village, went to town, coming with a different lifestyle, uh, you know, doing whatsoever determines they can do what they want to do, has to go back to saying, okay, what are these kids' parents? I mean, what values are they instilling in their child? So it's not going to be one hand fits all, whereby we can say, okay, the fault is solely from people traveling from the city to villages. At the end of the day, we need to also start thinking about what are the family values we have now in the 21st century. What are the values that parents are instilling in their children? And those are important questions to also think about. Go ahead, Teresa. Teresa, go ahead before I go to Zach. You're muted.
Yes.
Okay.
It's not a question, it's just kind of a comment, and I don't know how you see it, Anderson, and the issue of sustainability, because whenever you mention UN, UNICEF, World Health, and all that stuff, I call them as ad hoc services, because for Africa to maintain a good health or good socioeconomic viability in 21st century, the issue of sustainability has been an issue in my own head. And no matter where I go in many parts of Africa, the problem is exactly the same. How do you envision? I know it's beyond your scope because of limited resources, but as someone in community, how do you envision a sustainability of this sexual reproductive health among the women in the villages and among the men in the villages? Because there must have to be a buy-in, and that buy-in comes from a man and a woman. And Dr. Melo earlier said it takes two to tango. That's where I'm coming from. However, in order for any implementation to be effective, there must be sustainable work plan. What are the plans in place to have a sustainable outcome in the villages?
Thank you very much. I think what we are doing so far is to make sure we engage the community, not only the women or the girls, everyone within the community, and build up a strong structure that can sustain the program. And our program, we do engage community, people in the community, I should say, whom we do train on the different skills so that they can able to continue doing the services. That's why we do introduce safe space within the community, so that even the program ends, those people who have been trained can continue doing the activities. I think that's the strategy we use. And this international organization, yes, they do ad hoc activities. But now with localization, they are supposed to work with the local organization and grassroots organization so that this grassroots organization can able to continue when the international organization leave.
Okay, that's perfect. Thank you. And thank you, Teresa, for the amazing question that you posed. I'll turn it over to Zach. Zach, go ahead.
Hi, Doc. Can you hear me?
Yes.
First of all, thank you for inviting me. Very informative, excellent podcast. So, two questions. So yeah, this is new information to me. I'm kind of naive to it, but it's very informative. First question: this problem, is it widespread throughout the continent of Africa, or is it just more prevalent in Malawi? Second question: when you are giving the preventive education, I'm interested in what's the reception you're getting from the young men. So those are my questions.
Sorry, can you come again with your question?
Okay, can you hear me?
Hello, can you hear me?
Yes, I hear you now. So my question, first question, the problem that you're having with sexual reproductive, is that a problem that's widespread throughout the continent of Africa, or is it just more prevalent in Malawi? The second question, when you are giving your preventive education, especially to the younger people, I'm interested in the reception that you're getting from the young men.
Okay. First, let me answer your first question to say that sexual reproductive health rights problem is a common problem in most of African countries because we do share the cultural and also most of the things like religious issues. We are like the same. So, but I was just talking about our country, Malawi, what we are experiencing and what we are doing so far. What we are getting from the young people when we are doing our interventions, I think I've already said that there's a mixed outcome. Some they have they will accept, some they will have to reject some of the information. So that's how it goes, but it depends on the district, because here in Malawi we have 28 districts. So within the district, most of the districts, they have different cultural cultural practices differ from other districts. So you find you go into the other district, maybe you can be welcomed and you can do your intervention. They will at least before whatever you teach them. You go into the other districts, it becomes hard because of how the culture is built up in that particular district. I think that's how it goes here in Malawi.
Great. Thank you, sir. Got it.
Yeah, and just to add to your question, Zach, that's a very, very great question that you posed. And I agree with the assessment that our brother Henderson provided. We have problem in our African continent. Science, technology, infrastructure, capacity building is not improving the way it should be improving. And I agree with Henderson. Religiosity has a lot to do with these issues, whereby we have gone to the point where we get to, total depravity, whereby we think, due to religiously and perhaps culturally, that somebody else is going to do the work that we're supposed to be doing. I also have to add it to the issue. I wrote a paper last year on sustainability, and my paper focused on California intervention for colorectal cancer. Even here in the US, we're having an issue with sustainability. And I agree with Dr. Ogidi Teresa that just posed that most of the funding, whether it's a sexual reproductive rights that you get for this program, doesn't come from the continent. You know, it's like they have plates on their hand begging for money for every health outcome you can think about. It's either coming from World Health Organization, either coming from CDC and other European agencies. That should not be happening in the 21st century in Africa. The question is, why is this continue to happen? Because you can never develop a country without sustainability. You can never develop a continent and develop the mind of the people when they are still mentally enslaved. So there's a bigger issue, and unfortunately, it does not only apply to sexual reproductive right. I can go to cancer issue, the same issue will happen. I can go to a lot of health outcomes. It's just the same across any African continent that any African country you can go in the continent. So it's not unique to Malawi, but hopefully the younger generation will start to look at the problem we have in the entire African continent and start to make or start to ask a different question and start to make a different decision, because the older generation, I can tell you right now, failed Africa. You know, there's a lot of them that actually try to change, like Lumumba and so many of them that try to change Africa. But obviously, there's also a string of American, European influence that still hold Africa back. And that deals with, you know, other issues of slavery. But I will not only come into excuse that and say, well, you know, because Africa has the highest potential in resources, mineral resources, all type of resources is there in the continent. That's where the money is. Why should Africa continue to beg money for simple things that they can afford to do? And that's a bigger question. Thank you so much for that. Teresa, you raise your hand again. Any additional question or comment, or anybody else has anything to say?
No, Dr. Melo, I think I didn't bring it down. Thank you so much.
Okay.
Hello. I thought I was leaving.
Okay, hi, Professor Rosemond. Go ahead.
Yes. I need to make a few suggestions. Thank you very much, Anderson. Thank you very much. Those who have contributed to this discourse. I think it's a useful, extremely useful topic, and I don't think we can exhaust all that we need to know and learn and contribute to in just one session. That would be my first recommendation, that we bring it up again, maybe somewhere next year, and to have a follow-up on this.
I agree.
Yeah. So I would want to just highlight a few things that are happening in Botswana that maybe Malawi can also take from. When the host, when he brought up the issue of male involvement, it reminded me of the opportunity that I had working for UNFPA, that enabled me to contribute a strategy. I mean, they call it male involvement strategy. It's very interesting. Male involvement strategy. Why? For SRH back then. At that time, the right was not a component yet. Do you realize that the right is kind of a new development.
It's true.
And so back then, we were talking about SRH. Those who have been in the system for a while, it was SRH. And then we had the R. There's nothing wrong about it. But when you look at the three key rights, we're talking about autonomy over one's body and making the right choices. We are talking about access to accurate information and healthcare services. And we're also talking about freedom from discrimination, coercion, and violence. When you look at all these three, depending on the country, we are expected to adopt and adapt. So we did that. We have done that in Botswana. And somehow I was still the consultant looking at SRHR linkages in the entire health delivery system in Botswana. It wasn't an easy task, but we did something, and you realize that the good thing about this linkages strategy, call it, that we developed, we had an elaborate action plan, call it. We brought on board all kinds of collaborators, including the faith-based organizations, NGOs, CBOs, and so on. And it will interest you to know that all these partners had to actually come on board with whatever they have to offer. If you are not comfortable with reproductive health, which includes safe abortion services, you don't touch it. But of course, if you don't touch it, you have to have something that deals with unsafe abortion or stay away, whatever. Because the key issues of reproductive health were laid out. Maternal health, which includes prenatal, delivery, postpartum, and of course, safe abortion services. And then, even most critical, prevention and management of reproductive health issues, which includes infertility and menstrual health. I heard Henderson mention menstrual health. Sometimes that eludes us. We forget about that. And we don't have NGOs in this area. But for us, because we're looking at comprehensive SRHR, we included all that. And we were looking at the entire health system. The entire health system, of course, at the helm of affairs was Ministry of Health, and it's still Ministry of Health and Wellness. We've added wellness to it. And then partners, the private sector was there, CBOs, NGOs were there, and so on. So it was elaborate. So in addition to the male involvement, this male involvement strategy is as if males are always left behind. It was like an afterthought, but it was something that UNFPA did, and I think it is still a flagship of their strategies to say, male, come on board, even though we forgot about you. Come on board, come and be part of it. Reproductive health without men is unthinkable. And so that male involvement strategy is a strategy that is guiding how men can be included. And if you look at the rights, the three angles of the rights, it's freedom from discrimination. No one is going to be discriminated. So even if we discriminated against men, now they are on board looking at the male involvement strategy. And then, Doctor, you were talking about access to data. It's very critical. We are saying access to accurate information and healthcare services is the second of the three angles of the rights. Very good. And so if we are looking at the rights in its entirety, we are looking at all the three and not leaving one out. And also that brings me to my key suggestion to Henderson. I was asking myself, what's your focus? What's your niche? Look at the 3 rights. Look at the 6 blocks of reproductive health and sexual health. Look at where your niche is and make sure that you are making an impact, because if you are all over the place, it's not going to be easy. And so that will be my key suggestion, that you do that. Get your niche, identify it, and do it to the fullest. If, for instance, prevention and management of reproductive health issues, which includes infertility and menstrual health, it's something that you can do. It's an entry point for you to achieve the rest progressively. Do that and get the right collaborators to be with you. Thank you.
Thank you for the advice. I think it is noted.
So you can have access. These are documents that I did many years ago, but the male involvement strategy is still there. The linkages, SRHR linkages for Botswana, is also available. I can share those.
Thank you so much, Rosemond, Professor Rosemond, for this suggestion. I really appreciate that. It's very constructive. Henderson email is in the contact, so that you can share additional information with him. Also, thank you so much for reinforcing and reinstating the male involvement comment I made earlier. I think it's very important. It takes 2 to tango. Men in any community should be involved in sexual reproductive right. There's also sexual reproductive right. They are also included in that. So it should not be a marginalized case study whereby it's a women agenda. It should be a family agenda. Men should be involved. Thank you so much for that clarity. And there's nothing else to say about that, because that's a fact that should be addressed. We should not run away from this issue. And also, like you said, and I also mentioned it, there's a variety of components for sexual reproductive rights, and we should be comprehensive about that. We cannot allow one item to become the face of sexual reproductive rights, and that's where sometimes in the community we lose the community, because everybody has one directional view of sexual reproductive right. It does a lot beyond abortion, like you mentioned, prenatal care, infant health, maternal health. There are so many. That's very, very important, including prevention. So I really thank everybody for participating in this podcast. If anybody do not have any additional comments, question, or suggestion, I will end the podcast. But if you have any question or comment you want to post, please let me know, so I can allow you to have that time to ask the question. Next month, we're gonna have a professor from Burkina Faso presenting on endocrine disruptor. So I will also be sending the flyer out to everybody, sometime first week of next month, so that if you have time, you can add it in your schedule. Please, again, if you have not subscribed to our channel, please, I'm asking, go ahead and subscribe. I would be posting this podcast in the public YouTube channel either today or tomorrow. It will be in there. And if you already subscribe to our channel, you will get an alert that a new video has been posted. And if you get that, please do us a favor, share with everyone. If you're a professor, share with your students, because we need to start disseminating this type of information. We cannot make a change if people didn't know the struggles we are trying to fix. So the more we share the information, the more awareness we create in the community, and then that makes the advocacy so powerful at the end.